In rheumatic heart disease, the clinical features might not be clinically evident for years or even decades after the initial episode of the rheumatic fever. However, it presents. The signs and symptoms of this disease depends on which cardiac valves involved. During physical examination, there might be presence of cardiac murmurs, which is caused by valvular stenosis and regurgitation. The morphology of RHD are associated with inflammation of all parts of the heart, but the most important characteristic features are valvular inflammation and subsequent scarring. There will also be permanent thickening and retraction of the valve cups and leaflet. The affected valve, which the most common one is mitral valve, will exhibit leaflet thickening, commissural fusion, and shortening, which will have fish mouth or buttonhole-like appearance, and also thickening and fusion of chordae tendineae. Features such as shock bodies, which are pathognomonic for rheumatic fever, will already be replaced by fibrous scars, causing this lesion to be rarely seen in chronic disease. For the involvement of valve, mitral valve alone is involved in 70% of cases, while for combined mitral and aortic valve, the percentage is 25%. For tricuspid valve, it is less frequently involved, and as for pulmonic valve, it can be said to almost always escape injury. In the diagram level C, we can see the presence of mitral stenosis with diffuse fibrous thickening and distortion of valve leaflets and also leaflet thickening. We can also see the fish mouth or buttonhole-like appearance, which indicates presence of commissural fusion. For the diagram level C, the arrow is pointing to new vascularization at the anterior leaflet of an open rheumatic mitral valve. There is also thickening and shortening of chordae tendineae, which are the structures that looks like strings. When making diagnosis for RHD, we need to check for the patient's past medical history, do physical examination, and do some tests such as echocardiogram and chest X-ray. For the past medical history, check whether the patient have had any streptococcus infection before, and when doing physical examination, check for any presence of murmur. For the investigation, echocardiogram will help to check chambers and valves of the heart. As for the chest X-ray, it can help to check for the size of the heart, whether it is in normal size or enlarged, and also to see if there is any presence of excess fluid in the heart or lungs.